we should be taking a maternal diet in pregnancy extremely seriously. We know by the science of epigenetics that it's not the genes that you're born with, it's how those genes are expressed that's important. So you may have a gene for a long, healthy life, but if those genes aren't expressed, then there's not much hope for you. And so we now know that what mother eats and drinks during pregnancy, or even before pregnancy, and even if father smokes, then the baby is born with a predisposition for obesity, diabetes, and cardiometabolic disease. To an extent, any food can be part of a healthy, balanced diet. So, for instance, I like to think I've got a good, healthy, balanced diet, but I love crisps. And if anyone ever banned crisps, I'd be in a terrible state. And so I have crisps, but not very often. I know that I should have one bag every couple of weeks, something like that. So as long as those foods which we love but are unhealthy are restricted to just a luxury item or just every now and again, then that's fine, as long as the rest of the diet is balanced with fruit, vegetables, fibre and so on. I have a big problem with the current Eat Well plate because we have a body of evidence, a huge body of evidence as to what's a good diet, what's a bad diet, low carb versus Mediterranean versus low fat. And low carbohydrate diets at the moment tick all the boxes. They reduce weight more thoroughly, they maintain weight loss better, blood pressure is reduced better, blood sugar is reduced better, and cholesterol. And so the evidence is there, but the Eat Well plate gives exactly the wrong message. It's loaded with carbohydrates. It's loaded with bread and rice and pasta in the carbohydrate section. There's a glass of fruit juice in the fruit section. There's sugary yogurt in the milk section. And the fat section is a bag of crisps, a packet of biscuits, and a pie. And so it points us in entirely the wrong direction, and I think they should all be burnt.